All right, welcome back in. Brookwood Baptist Medical Center is now offering an advanced gynecological procedure known as vaginal natural orifice transluminal endoscopic surgery, or vNOTES, to perform hysterectomies. And today we have Dr. Heidi Straughn, an OBGYN at Brookwood, to tell us about the advantages of this procedure. How you doing, Dr. Straughn? Thanks for joining us.
Great. Thank you, Sheldon. I'm fine.
So I got to ask, what is this vNOTES procedure?
Well, as you know, it's a pretty large acronym, but what it really is an alternative way to have a hysterectomy or other gynecologic procedures. It is minimally invasive, meaning it has the least amount of, well, no visible scars and very few incisions, and that has a lot of benefits for the patient.
So that's different than the traditional hysterectomy then, kind of the difference between the two. Explain that.
Correct. So traditionally, way back in the past, we did hysterectomies by cutting in the abdomen, and then we moved to doing laparoscopic hysterectomies where we could make small incisions in the abdomen, then robotic hysterectomies where we could do more complicated hysterectomies but with small incisions. Now what this does is it uses the natural orifice of the vagina to make the incisions up inside. So therefore you can use the same or similar procedures with less incisions, which of course then has a lot of benefits.
So if you're going to have this procedure, what is it that you need to know about before, during, and after?
Okay, well, it's definitely something you want to talk to your physician about. Because not everyone would be a candidate. It may depend on their previous surgical history, deliveries, things like that. For a lot of patients, it's someone who would has menstrual issues, bleeding problems, something called uterine prolapse. This would be a great opportunity to have a hysterectomy with a very quick recovery. Or if someone is interested in having a tubal, we can remove the tubes this way as well. And this is great for patients, again, that maybe have, maybe are larger patients, maybe patients that have had a lot of abdominal surgery that we're worried about scar tissue inside. So this might be a safer alternative for those patients. But it's something you need to talk to your physician about to see if you're a candidate. And then I think at that point, there's a lot of conversations, and sometimes it helps to talk to the physician and really get an idea for how this procedure works.
Yeah, what's been the response so far?
Oh, it's been great. What I've really noticed is the very quick recovery my patients have. Several have gone home from hysterectomy the same day of surgery, not requiring any pain medications other than Tylenol and ibuprofen. I've had some go back to work at a week after their hysterectomies, so I've just been very impressed with how quickly they're back to life as normal, which means a lot for a lot of women.
Okay, you had touched upon, would you be a candidate of this? What would keep somebody from not being a candidate?
Sometimes if someone has a really large uterus with fibroids, that might be more technically challenging. If someone has a big cyst on their ovary, but they've already had a hysterectomy, this is not an appropriate way to get that cyst off. But certainly there are a lot of patients who are candidates for this. Yeah.
Dr. Heidi Straughn right there, and like she said, before any type of treatment like this, always consult your doctor, OBGYN. Heidi Straughn, Dr. Heidi Straughn, thanks so much for joining us. Definitely a procedure that we need to know about. Thank you.
You're welcome. Bye.
Fred?